In addition to laser vision correction, our doctors also offer the latest advancements in lens implant technology. Today, FDA-approved multifocal lenses are available for men and women above the age of 40 that can help restore your near, intermediate, and distance vision without reading glasses or bifocals.
As we age, the crystalline lens in our eye becomes thicker and fatter. In order for us to focus up close, our muscles in our eyes relax and that lens becomes more spherical, more round, and we can see up close. But try to imagine something that becomes thicker and fatter over time. It doesn't bend as well. So then when you get over 40, you have this thicker and fatter lens that can't focus up close. Your arms aren't long enough, and that's the process of presbyopia. 100% of the world gets it. Some people at age 40, some at 45, some at 48, and a few at 50, but 100% of the world gets it. Well, with lens replacement, we've also recognized that just giving a patient monovision with a focus here and a focus in the distance, which is okay, patients want more than that. And luckily, now we have new technologies that allow the patients to see in near, at intermediate, or in the distance with one or both eyes. These new types of multifocal lenses have revolutionized the way we do surgery.
When a patient comes in is going to have a refractive lens exchange, they have a choice of what lens they want and what lens in conjunction with the surgeon would be best for them. So the conversation typically is, well, what do you like to do? What is your occupation? Because some lenses, have a greater incidence of maybe having glare at night. So if you drive for a profession or you do a lot of night driving because of what you like to do, that may not be the best lens for you. Or if things that you do are kind of out here at intermediate distance, that would be one lens. Whereas if you have most of your things are here, you like to read, and that's what you spend a lot of time doing. So there's one lens that's good here and good far away. So we have choices based on your activities, your profession, what you want, what you like to do. So it's a conversation that you need to have with the surgeon. The old goal of lens implant surgery was to give someone excellent distance vision because we had no other alternative. Now we have lenses that actually mimic the natural state of the lens back when you're 30, so it moves a little bit and allows you to kind of change the focus. And some lenses have fixed focuses, but fixed not only at distance, but either at intermediate or close up, which we call multifocal lenses. So now the goal is not only to give someone good distance vision, but to give them visual freedom, meaning to be able to function in their everyday with no glasses at all.
For patients with moderate to severe refractive errors who are not ideal candidates for laser vision correction, our doctors also perform refractive lens implants, or RLI, which is similar to implanting a contact lens inside the eye.
Well, one of the exciting things that happens in refractive surgery is that each year we nibble away at the refractive errors that we couldn't correct beforehand. And so in the last 2 years, we've now bitten off a big chunk. We can now correct those patients who were not candidates for laser vision correction, and they don't have any cataracts. What could you do for them? Well, we now have 2 technologies to correct patients who have very, very high nearsightedness. Those people have those Coke bottle thick glasses that they can see about an inch away from their face. These 2 technologies literally place a lens inside the eye, not in the cornea, but inside the eye without taking anything out. And that gives us the ability to correct these forms of nearsightedness. And coming very soon will be lenses just like these that are going to correct nearsightedness and astigmatism. Right on their heels will be these lenses to correct farsightedness, and then right after that are going to be these lenses to correct farsightedness and astigmatism in patients that cannot have any other form of surgery. The technology is the VeriSize anterior chamber lens and the STAR posterior chamber lens. The outcomes have been stupendous because you're taking patients who are -10s, -12s, -14s, who without glasses would be detriments to themselves under any emergency circumstance, and we're giving them back 90% improvement in their vision within a couple days. And this is extremely exciting for the patient. So in terms of outcomes, you get that bang for the buck, but there's something else you get. Because you're not operating on the cornea, the patients get a magnification of their image to a large degree compared to corneal surgery. What that magnification translates into is picking up an extra line or 2 of vision on the chart. So prior to surgery with a -12, the best vision might be 20/20. But after surgery, when that's corrected, they could be 20/15s or 20/13s, and that's a big advantage for this type of surgery compared to when we operate on smaller prescriptions on the cornea. Well, what's interesting today is patients with these really bad prescription errors that couldn't be helped in the past now can be helped by the technology where we place a lens inside the eye. But some of these people also have very severe astigmatism. So how do we correct these things? The second issue that we have is predictability of outcome. When you have giant prescription errors, there is always going to be some range of result where the prescription might end up being for the eye a -1 or a +2. How do you correct for those? We do what's called bioptics. We create the laser flap of the cornea first, and then a week or a month later you come back and you place the lens implant in the eye. You then measure the outcome in terms of prescription, and then all you have to do is just lift up that flap and treat the residual prescription with the laser and lay it back down again. And all this is bundled into one procedure. You can't get this anywhere else except here right now. The bioptics procedure has been one of the most exciting things to take care of people who were terribly handicapped and we had no other options for them.